Namaste. Thank you for joining us here on SLG Hello Doctor, your bi-monthly virtual health digest. Today, our conversation with Dr. Archana Prathipati, consultant radiation oncologist at SLG Hospitals, Hyderabad, will revolve around cancer and COVID-19, the unfortunate duo and the added misery. COVID-19, quite easily the biggest pandemic of the 21st century, has infected more than 40 million people pan-India, and the surge is still on, 2 years since its onset. With a 3 times higher infectivity rate and 5% higher mortality rate, COVID-19 is especially traumatic for cancer patients. In the beginning of the pandemic, healthcare systems had suspended all less emergent therapies, including cancer care. They were resumed later on with better understanding of COVID disease pathology and management principles. As cancer treatments are immunosuppressive, cancer patients are more vulnerable than others. With increasing mutations, emergence of newer virus strains, and reinfections, cancer patients and caregivers must be prepared to combat COVID infection successfully. Close the care gap, the theme for 2022 World Cancer Day, which fell on the 4th of this month, rightly focuses on the current scenario of care gap due to the pandemic. We are grateful to Dr. Archana for joining us today on SLG Hello Doctor to answer some typical questions that a cancer patient would have. Welcome, Dr. Archana. It's so good to have you back here with us on SLG Hello Doctor.
Yeah, hello. I'm glad to be back here. Thank you.
Shall we start?
Yes, ma'am.
So, doctor, since we are going to be talking about cancer and the effect of COVID on cancer, let's start from the beginning. So, what happens when a cancer patient catches a viral infection?
Viruses are proven to be etiology behind cancer. National Cancer Institute states that viral infections can cause cancer in 1 out of 10 individuals in developing nations. And we know that certain types of viruses, for example, flu virus is known to cause immunosuppression, and this increases tumor progression rate. For example, hepatitis B virus, it can cause liver cancer. Hepatitis C virus also liver cancer. So there is a long known association between virus and cancer.
Doctor, lately we've been hearing about chronic COVID. So is there something like chronic COVID, and if yes, why should we be worried about it?
Actually, there is a term called chronic COVID. So any symptoms of COVID lasting for more than 12 weeks are considered chronic COVID. So this is seen in 10 to 15% of patients who recovered from COVID illness. So we are more concerned about neurological, cardiovascular and coagulation abnormalities associated with COVID in chronic COVID survivors. But a recent scare is that as COVID causes immunomodulatory effects and chronic inflammation, and inflammation is a known etiology of cancer, we are more worried that this chronic COVID might play with cancer.
Doctor, now that you have established that chronic COVID is indeed a thing, what is the impact that it has on cancer patients?
We all know that chronic COVID causes chronic inflammation, and this chronic inflammation may tip the balance towards pro-carcinogenic status, that is the chance of having a cancer more. So this may lead to increased tumor progression rate or increased cancer rate also.
So doctor, how are COVID patients impacted by cancer?
We all know that cancer patients are being treated with chemotherapy and radiotherapy, and this causes little immunosuppression, and this immunosuppression increases the chance of infection rate also. Apart from that, it also increases mortality or fatality rate in COVID cases. The probability of having severe COVID infection is also higher in cancer patients. It is up to 70% higher than regular people. And it is also known to cause tissue inflammation, which increases the suffering in stage 4 cancer patients. That is, increase in symptoms like pain, increase in symptoms like ascites or any fluid retentions. So in a way, it affects quality of life of cancer patient.
Doctor, surprisingly, reports say that there is a drop in new cancer cases during the pandemic. Why is that so?
This is due to 2 reasons. One, as we have suspended all non-emergency healthcare services in the beginning of pandemic, so elective cancer screenings were also being scheduled for later date. That is why we are seeing a decrease in number of screen detected cancers, like for example breast cancer or cervical cancer. But surprisingly, non-screen detecting cancers like for example anal canal cancer or lung cancer, the numbers are low because patients are scared of visiting hospitals. So they are postponing their visit until they get an emergency symptom. That is why we are seeing less number of people being diagnosed with cancer during pandemic. According to National Cancer Institute, they say that there has been a steep drop in cancer diagnosis, but there is no reason to believe that the actual incidence of cancer has dropped. We also believe that this pattern may lead to a worrisome increase in advanced cancers later date.
It's break time on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ ఎస్ఎల్జీ హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ జేసీఐ అండ్ ఎన్ఏబిహెచ్ ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ఐసీయూ బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల ఎంఆర్ఐ, సిటీ స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. We are in conversation with Dr. Archana Prathipati, Consultant Radiation Oncologist at SLG Hospitals, Hyderabad, about COVID and cancer, the deadly duo. Doctors, from what you said, it's evident that since people are hesitant of approaching doctors and hospitals, new cancer cases are going undetected. Similarly, there should be a lot of impact socially also. So can you talk about that?
Yes, there is an impact because the unavoidable decision to delay cancer care to decrease community transmission kept many new patients away from diagnosis, as well as it also kept existing patients away from response assessment and salvage therapies. So this definitely has a deteriorating impact on quality of life of cancer patients, which we are all concerned about.
Doctor, it's clear now that patients are not approaching you despite having certain symptoms, which means the cancer care actually is getting postponed, which in turn would lead to aggravation. So how do you think this can be mitigated later when you actually take up those cases?
As we all know, certain cancer therapies are immunosuppressive and active infections are known to flare up during cancer therapies. And apart from active infection being flared up, there is high risk of severe COVID or reinfections. But postponing cancer care until pandemic situation is over is not a practical solution. And these days we are seeing more number of cancer patients being affected by COVID because they have to come out for some day-to-day activities. How are we mitigating is research is ongoing to explore drugs which act on the DO, like for example tocilizumab, which is used in cancer therapy. It also dampens cytokine storm mediated by IL-6. So we are trying to adapt this drug as a potential therapeutic agent in COVID. Similarly, there is another drug called imapilimab, which is used in leukemia. We are also trying to explore this drug as a therapeutic treatment for COVID. So further studies are needed to repurpose anti-cancer drugs for COVID therapy.
Doctor, are there any negative reactions to be expected from drugs used for either of these diseases?
Yes, because antiviral drugs can interfere with cancer therapy drugs, like for example trastuzumab, which is used in breast cancer, or enzalutamide, which is used in prostate cancer. These drugs are known to interact with antiviral drugs. So when we are using antiviral therapy for COVID in a known cancer patient, we always keep a checklist of drug interactions in our mind.
Doctor, do you recommend any special diet for patients who have both these conditions together?
There is no special diet to combat this deadly infection, but healthy nutritious diet is recommended, and this should include fresh fruits, green leafy vegetables, plenty of proteins and antioxidants.
Lastly, doctor, but most importantly, especially given the World Cancer Day theme of close the care gap, what should be done actually to close the prevalent gap that you're seeing now?
So during pandemic, many of the people are worried of visiting hospitals for non-emergent situations. So we are seeing lot of advanced presentations. So there is a care gap in the cancer care. So we are trying to find ways to amend this care gap. So on the positive note, this pandemic taught us to do healthcare outside hospital. For example, we are trying to do teleconsultations and follow visits online, and we are also trying to do home sample collection. And there is proper like appointment and time management so that patient will spend minimum time in the hospital. And strict adherence to COVID appropriate behavior is a must, because that will decrease the risk of getting reinfection or getting a new infection. And apart from that, we all should stick to existing cancer screening protocols and get screened for regular recommended screen detected cancers. And please visit a nearby hospital or doctor for any non-emergent symptoms which are bothering for more than 2 weeks. In that way, we can decrease advanced cancer presentations, and this is also going to be a way to decrease the cancer care gap.
Dr. Archana, thank you so very much for explaining so patiently what a cancer patient should expect from a COVID infection and how to take care of themselves. And it's such good information for caregivers too. Thank you so much.
It's my pleasure to be here, and I hope many of the cancer patients' queries are being answered by this session. Thank you.
Viewers, we'll say hello to you in 2 weeks from now. Until then, be aware, be healthy, enjoy life responsibly. Namaste. Viewers, don't forget to hit the bell icon to keep yourself updated on all that's happening at SLG Hello Doctor.